Hey guys, today I'm going to demonstrate treating tennis elbow using Graston Technique. Graston Technique is instrument-assisted soft tissue therapy using specially designed stainless steel instruments. You can see here there are 6 tools and they each have different shapes and different sharpened edges, if you like, to adapt to the differing contours of the body. So we're going to start by treating Lou here today. I'm going to use GT5 here. In treating with Graston Technique, we have to lubricate the area before we apply the tools. I like to use physio cream because we get a double whammy. It's anti-inflammatory for muscles and joints. So we'll start here. I'll just straighten Lou's arm. And we're going to do these repetitive scraping type motions through the forearm extensors of Lou's right elbow here. And you might see, if you just zoom in a little bit, we're getting a bit of redness. And it's this effect that we're trying to achieve in the tissues. We're bringing blood to the surface, specifically to the tendinous portions of the forearm extensors. There are different sort of maneuvers you can do, sweeping type gestures or just a straight up sort of scrape. You can work your way through these tissues in any way that you like, but the key is really just to get that redness. So just a bit of feedback here, Lou, what does it feel like?
Very comfortable for now.
Is it painful?
No, sorry.
Does it feel like scraping, or does it feel like...
Feels like a scrape, yeah. You're working on the muscle and I can feel the tissues as well.
So you're a chiropractor as well. Does it feel therapeutic?
100%. I can actually feel my arm warming up as well.
Yeah, okay. So it's probably, a traumatic response, but a desired level of trauma. So we've kind of done one level there, and then I'm going to break out another tool. You'll see this one, if you come in closer, it has a double edge here as opposed to this one that has a single edge. I don't know if that comes out, but it's also contoured, so it helps me get around the epicondyle, of the humerus. It's just a different way of getting into these tissues, and then if I just get this slightly sharper edge, I can sort of work a bit more finely on those tendinous portions. I'll do that for a little bit, and then I'll grab my last tool here. They call this framing. This is when you come around sort of more bony points of the body, and it's a bit more sort of fine work. You can see here, this is probably the most aggressive Graston tool. You can use the ice pick method like that and get stuck in. Obviously around the elbow, it's a more delicate region, so we don't need to apply as much pressure, but say around the hips or something like that, you might need to get stuck in a bit more. So that's it. We'd hassle that for about 5 to 6 minutes, and I'd supplement that obviously with dry needling, active release technique. I might rock tape his forearm, and we could even do some cold laser therapy treatment on it, whether it be acute or chronic. But that's the gist of it. Thank you.